Contusions and strains, they are types of soft tissue injury. So contusion is usually secondary to blunt force, and so this is secondary to bleeding inside the soft tissue. So it's basically when, let's say, you accidentally bump, I don't know, your knee or your leg into something really, really hard, and it causes bleeding underneath there. So it's basically a big bruise. So this is when large amount of blood collects under the skin within the soft tissue, causing a hematoma. Strain, on the other hand, is basically an overstretching injury. So the tendon gets stretched and sometimes it causes some tearing. So this is due to mechanical overload again. So this is when the tissue gets extended past its elasticity. And typical signs and symptoms of strains would be pain, limited motion, muscle spasms, swelling, and possible muscle weakness. An easy way to remember strain or how it happens is when, if you look at the first three letters of strain, STR, right? And then look at the first three letters of stretching. Strain and stretching, they start with the same three letters. So hopefully this helps you remember strain and overstretching or stretching of the muscle tendon unit. So typically when a patient complains of a strain, they don't really tell you that they have a strain. The main complaint is, I pulled a muscle, right? So they will say, I pulled a muscle. So again, that would be strain. So pulling a muscle is strain. So we strain muscle. I want you to know the difference between strain and sprain. So we're going to talk about sprain next. Sprain, on the other hand, is basically an injury from stretching or tearing of a ligament surrounding a joint. So we sprain our joints. So typically the most common areas that we sprain are our ankles. Another one would be our knees. So signs and symptoms, depending on the severity, patients may complain difficulty moving that area. You may see some discoloration, bruising, swelling, pain. And again, this involves the joint. So we sprain a joint, we strain a muscle. Next is dislocation. So dislocation, from the name itself, this means no or not. Location is place. So this is when two bones separate or become out of place. So again, definition of dislocation is ends of two connected bones separate. So this is a result from extreme force put on a ligament. This is when a bone comes out or gets disconnected from where it needs to be joined. Causes of dislocations can be congenital, and the most common site of dislocation is the shoulder. Subluxation is basically an incomplete or partial dislocation. So it's partially off, but not completely out of place. So that's subluxation. Another common complaint is muscle spasms. So muscle spasms have different causes, so it varies depending on the situation or a person, but common causes of muscle spasms are muscle fatigue, so from overuse, heavy exercise, again, overly using certain muscles, dehydration for sure, low calcium or magnesium levels, kidney failure because it does affect the electrolytes as well, hypothyroidism, and alcohol abuse. Common locations of muscle spasms would be calves, neck, or lower back. So especially in nursing, it is very common to see nurses, not just patients, with complaints of low back pain. And now, depending on the patient, you may also see a lot of neck pain, especially their types of job require them to lean down or pull patients often, so such as nurses. So again, these are common complaints of nurses as well as patients. So most muscle spasms basically go away on their own, especially when we resolve the main cause of the muscle spasms. So duration of muscle spasms are usually short. So 90% of people with muscle spasms recover within 3 months, and it doesn't mean that it takes the whole 3 months. So that's just a range. Most people typically recover within a few days to a week or two. Common treatment for muscle spasms, definitely hydration. If we know that the cause is dehydration, then we have to hydrate our patient. And again, when we hydrate, we need to make sure that we're just not replacing the fluids, right? We also need to replace the electrolytes that are being lost. Now, non-medical treatment for muscle spasms would be relaxation, yoga, massage, and heat, especially if the muscle spasms are caused maybe by high stress levels, or again repetitive motion or certain positions related to their jobs. So again, this can be treated with some massage, relaxation, yoga, and so on. At times when we did all our conservative measures, if it's still not working, then another option would be medication. So common medications that we use would be muscle relaxants. So example of muscle relaxants would be Flexeril. Another one is Carisoprodol or Soma. And there are different muscle relaxants in the market, but most of these muscle relaxants are actually prescribed because most of them, their side effect is sedation. NSAIDs can be used especially if it's related to inflammation, opioid analgesics to treat the pain from the muscle spasm, and then opioid analgesics helps with relaxation as well. Steroids for inflammation, and if the cause is calcium or magnesium deficiency, then we can supplement with calcium and magnesium. And definitely if calcium is deficient, then we need to also incorporate vitamin D to help promote calcium absorption. Next type of injury is bursitis. So from the word bursa and itis, right? Bursa is bursa and then itis is inflammation. So this is when the fluid-filled sac gets inflamed. So bursa is the fluid-filled sac located adjacent to the tendons near the large joints, as you can see here in this picture, commonly in the shoulders, elbow, hips, and knees. So this kind of provides an extra padding and support to those joints. So it helps with the gliding and movement of the joints, and it prevents increased friction between tissues, and it prevents injuries. Now again, with bursitis, this is when that anatomical part gets inflamed for one reason or another. Bursitis can happen from many different causes, and some of the most common causes are injuries, infections, so that would be more of a septic or infective bursitis. Underlying autoimmune disorders such as rheumatoid arthritis can also cause bursitis, and other causes of inflammation such as gout or gout crystals within the bursa or joint area. Now, diagnosis, typically these are diagnosed through just clinical symptoms and x-ray. So this can be demonstrated on an x-ray, and again in combination of patient's complaint, which is typically pain, difficulty movement in that area. As mentioned earlier, bursitis can happen secondary to an infection. So septic bursitis, this is a type of bursitis from an infection. So this is considered urgent. So urgent medical interventions are necessary, and to diagnose and treat, some patients need to have that bursa aspirated, and they will collect some fluid from the bursa to be sent for culture and sensitivity to identify the organism, and also to identify the appropriate antibiotic to use for that specific infection. Once identified, so typically they can start to treat them empirically, so just based on their understanding of the common causes of the infection, a provider may start them with some sort of broad spectrum antibiotics, and they can start PO antibiotic, but sometimes they may need to have IV antibiotics depending on the pathogen. And depending on the patients, for some patients, they may need repeated aspiration of fluid, because with infection, sometimes it collects a lot of fluid, and it recurrently collects a lot of fluid, which requires aspiration to alleviate that pain from all that pressure. And at the same time, it can also help retest for the presence of infection, or basically to assess or evaluate the effectiveness of treatment. There are times that surgical drainage need to be in place in order to treat septic bursitis. So sometimes they need to open them surgically, and at times remove the bursa completely, especially if it is very difficult to treat, or if we're risking the infection to spread and cause sepsis or other potential issues such as losing an extremity or a limb. Carpal tunnel syndrome. So carpal tunnel syndrome is basically secondary to the median nerve being compressed, causing numbness, pain, and tingling in that distal part of the extremity. The most common cause of carpal tunnel is actually occupational. So typically typing, that's why it's very important to have ergonomic keyboards, ergonomic desk setup, and so on, because of that repetitive movement, the repetitive bending of the wrist causes small injury over time, but because of that recurrent inflammation and injury, it can cause some scarring, inflammation in the area, causing compression or pressure on that median nerve, which then will result in the patient's manifestations, which typically include pain, numbness, and tingling in the distal area or the fingers. So in addition to occupational costs, it can also be from recreational activities. So if somebody plays certain sports or maybe even playing video games, those can be common causes of carpal tunnel syndrome. This is a video about carpal tunnel syndrome. Feel free to watch it. I will not show it to you guys through this lecture, but I may pull it out in class just so you guys can see. How do we diagnose carpal tunnel syndrome? So diagnosis is based on the history and physical. So again, when we ask about their pain, when did it start, what type of job do they do, what's their lifestyle. So that kind of gives us an idea of what they have. And the symptoms are, to be honest, they are pretty, for the most part, they're pretty straightforward. And for the most part, providers can easily diagnose carpal tunnel. Some of the tests that we can do to identify or to kind of help diagnose carpal tunnel are the Fallon test and Tinel sign. So Fallon test is when you put your hands together and kind of have them flex. And so you have the patients do that. And then if it's positive, so meaning they start having the signs and symptoms of carpal tunnel, which is numbness, tingling, and pain, then there is a high likelihood that they have carpal tunnel. Another test would be the Tinel sign, wherein we tap the medial nerve, and again, it causes the symptoms, which is pain, numbness, tingling to that distal part of the hand. So the symptoms include numbness. Depending on the severity, it can cause muscle weakness. Sometimes to rule out other potential reasons for the symptoms, they may do an X-ray or MRI to see. So X-ray mainly will let you see if there's any bone deformity. So it's more to see the hard tissue, which is the bone. MRI will allow you to visualize the soft tissue. Some interventions for carpal tunnel. So non-surgical, so conservative or non-surgical interventions include drug therapy. So typically with carpal tunnel, sometimes carpal tunnel is really asymptomatic for a while until inflammation happens. So there's so many different reasons for inflammation. So sometimes if it's more a flare-up from inflammation, NSAIDs and steroid injections are very effective. So that would be a more conservative way to treat it. Immobilizing the wrist or putting a splint to avoid movement and bending and to prevent further damage, right, and recurring injury, that usually helps, and it kind of helps expedite the healing process. And for the most part, for many people, the conservative methods are quite effective. However, for some patients who have been experiencing it for a while, and maybe they've been doing their jobs for 20, 30 years, right, for repetitive injury from their occupation, there are some patients whom after all this conservative treatment, it's still not effective and their symptoms are getting worse. Then our last resort will be surgical intervention. So surgical intervention is required in half of the clients with carpal tunnel. Again, because typically most people remain at their jobs, continue doing whatever hobby that they're doing, and it gets to the point that the injury is definitely not reversible, and again, the conservative treatments are no longer effective. So how do they do a surgical intervention? So the main purpose of the surgical intervention is to release or open up the area to decompress the nerve. So for the nerve to not be compressed. Two methods that we're going to talk about are the OCTR or open carpal tunnel release or the endoscopic carpal tunnel release. And so this will just depend on the patient's anatomy, doctor's preference, and maybe other issues that maybe the patient is experiencing, and maybe the patient's anatomy and the complexity of the case. So for endoscopic release for carpal tunnel syndrome, as you can see here, it's less invasive. So it's more endoscopic. The openings are smaller compared to the open carpal tunnel release, which is this one right here, where then they actually open it up and release the compressed nerve. Other common musculoskeletal injuries that patients may complain about are knee injuries. So common areas that get injured in our knees are the meniscus. So pathophysiology, this is typically secondary to tearing of medial meniscus or the lateral meniscus. So this is usually from twisting of the leg when the knee is flexed and the foot is on the ground. So you'll see this often, maybe secondary to some sports, especially soccer is one of them. Basketball, depending on how shifty the player is, that can actually lead to a meniscus injury. Signs and symptoms of a torn meniscus. So pain is one of the common indications or manifestations or cues for a torn meniscus, as well as swelling and tenderness in the knee. So typically with this, it also includes clicking or snapping around the knee area, especially with movement. A test that providers can typically use to evaluate for a torn meniscus is the McMurray test. So the McMurray test, as you can see over here, this is done by the provider by bending the knee and then at the same time pulling it to one side while pushing the other side of the knee and rotating the leg a little bit. And so if the patient experiences pain, snapping, clicking, or basically having symptoms, then that we can say that the McMurray test is positive. Therefore, the patient likely has a torn meniscus. Now, this is not a definitive test. The main way to really diagnose is to do some imaging to confirm. But this is, I guess, a non-invasive and more timely way to evaluate for a torn meniscus. Treatment for torn meniscus. So typically, there are some patients who can actually get this injury treated conservatively. So when we say conservatively, through over-the-counter medications, even some prescription medications to help with inflammation, pain, and all the symptoms, as well as resting it, icing it, compressing it, and elevating the affected area. Now, there are some patients though that for one reason or another, they may not feel better after all conservative methods have been implemented, and maybe their symptoms are getting worse or they're not getting better, it's affecting their quality of life, then some patients may need to have a surgery to fix the torn meniscus. So they can have either a partial or total meniscectomy. Partial from the name itself, so just part of the meniscus is being removed, or total meniscectomy, that's when the total meniscus is going to be removed. The main thing that I want you guys to remember is the post-op care. So part of your post-op care, as you guys already know, so whenever we're dealing with extremities, you have to do neurovascular checks. And again, remember your 6 P's and always compare one extremity to the other. And definitely check for signs and symptoms of bleeding and making sure that the patient follows the exercise protocols, exercise instructions from the provider or the surgeon, as well as from physical therapy. With many of the joint surgeries, it is very important that the patient starts physical therapy as soon as it's safe, because if they don't use that, they don't move those joints, what happens, it may heal, it may cause some stiffness, and it can limit their range of motion. Interdisciplinary care for soft tissue trauma. So these are just general treatment for all the types of injuries that we discussed earlier. So all the contusions, strains, sprains, muscle spasms, and so on, right? So anyway, so all those soft tissue injuries, the main goal is to reduce the swelling and pain. So one of the interventions that most patients can actually start implementing at home, and we can start educating them about, is resting, icing, compression, and elevation. So resting, pretty self-explanatory. They just have to rest the area, especially if it's newly injured. If you don't rest it, you can just repetitively injure and re-injure the area. Icing allows vasoconstriction, so that icing helps with swelling, and at the same time, because of the cold sensation, it helps with pain management. Compression, it allows stability and it kind of protects the area from being overly stretched. It also helps with inflammation, and because of that compression sensation, it may help a little bit with the pain. And then elevation, it helps with edema, therefore helping with the pain a little bit. Now, x-rays are typically done to rule out fractures. So that's the main thing. MRI is usually done to see if there's any soft tissue trauma. So typically in x-rays, you won't be able to see injuries to the ligaments. You won't be able to see, again, soft tissue trauma. If you want to see more detailed and higher definition imaging of soft tissue, you have to have an MRI. Now, if the patient had a dislocation, definitely they need to correct that dislocation depending on what's going on with the patient. If there is inflammation in the area, such as in the knee or in the bursa, then they may have to aspirate those fluids to help with the symptoms, right? So to decrease the inflammation in that area, decrease the pressure, therefore decreasing the pain. And at the same time, they may use that opportunity to aspirate fluid to send to the lab if they're suspecting septic bursitis. Again, immobilization is important, especially to prevent further injury and to allow the body to heal. So splinting, using a sling, those can be helpful. And then medications, NSAIDs, so for inflammation, other analgesic for pain. And again, make sure that whatever it is that you're giving to your patient, one, you need to know why you're giving it, and your patient needs to know why they're receiving that medication. And in addition to that, we need to make sure that we're using it for the right purpose. So if it's NSAID, right, so it's really appropriate for pain and inflammation. And we need to educate our patient about that. We need to educate them about the side effects. So for most commonly given NSAIDs, such as ibuprofen, we need to look at their kidney function, right? Is this the appropriate patient to give NSAID? Is there any potential for bleeding, right? Because NSAIDs can cause GI bleeding. So those are the things that you may want to consider. And again, when you're giving NSAIDs, right, look at any potential contraindications. So if there's any contraindication, definitely I would either clarify with the provider and maybe use or think of other alternatives that we can provide our patients rather than just administering it without really thinking about the potential consequences, especially if they have any sort of serious condition that's contraindicated for NSAIDs. Cortisone or steroids, again, going back, right, this is for inflammation. Know the side effects of systemic steroids, your GHATs. Antibiotics, that would be indicative if there's any suspicion of any sort of infection. So problem list for soft tissue injury: impaired physical mobility, range of motion. So if we know that that's a problem, definitely we need to check our neurovascular assessment, assess the patient's gait. Depending on what's going on with your patient, we may need to analyze their labs, specifically WBC if we're suspecting any sort of infection. Treat it with RICE, resting, icing, compressing, and elevating. Collaborate with the provider depending on what the patient needs. Maybe we need an order for anti-inflammatory. Maybe the doctor needs to order an x-ray and it hasn't been done. Maybe we have to collaborate with the physical therapy to ensure that the patient does their physical therapy exercises after their surgery. And again, teach our patient, because at the end of the day, we just have them temporarily at the hospital or the urgent care or maybe at the surgery center. But at the end of the day, they have to go home and they have to be able to care for themselves so that hopefully we can prevent readmission or re-injuring that area. Use of adjunctive devices. So do they need, again, compression, slings, and so on? Medicate with, depending on what the cause is, their symptoms. Make sure that we have the orders or prescriptions, and then always evaluate for the response. So if we administer a medication for pain, if it's PO, typically we need to reassess it within the hour. If it's IV, we need to reassess it within 30 minutes. And always, again, anything that you do, you have to go back and evaluate for effectiveness of the treatment, and at the same time to evaluate just in case the patient develops any potential side effects from our interventions. So with our medications, again, know the side effects of NSAIDs, opioids. We talked about NSAIDs earlier, opioids. So again, respiratory depression. So most common side effects for morphine: nausea, vomiting, dizziness, hypotension, bradypnea, respiratory depression, sedation. So please review those and memorize those. You never know, you may see them on an exam. And this is just a repeated slide All right, so I think I'm gonna end it here. We're gonna continue on with signs and symptoms of fracture when I see you guys in class on Tuesday. Yeah, so that's it. So please make sure to read the lectures before class, and that way we can have a more interactive discussion. All right, see you guys on Tuesday.